Hi, this is Josh, Dreambody Clinic, and we're going to talk about the knee treatment. The most common treatment we do here at Dreambody Clinic are knees. Everybody's knees go at some point, it seems like. It was the first thing I ever did. Had multiple meniscus tears, partially torn ACL. Quick, easy injection fixed all that up. You can see my before and after MRIs on the website to prove it. This week, we treated my mom and her husband, my stepdad, Blake. So their life, all they do is play tennis, golf, pickleball. I mean, they got the dream life. They get to play every day. It's awesome. But that wears on the body. So nobody wants to be out there in pain, anything, and they've got me to take care of them. You know, I want mom feeling as good as possible and, you know, being happy. So we did her knees, did Blake's knees, and a really quick, easy injection. Now look, they were at our place last night. My mom's knees were getting a little sore post-injection. Took a Tylenol, pain went away. That's kind of your worst case scenario with these treatments. They're so safe and easy. There's no risk of rejection. They're totally ethical. We take them from umbilical cord and placenta. They're super safe. And they get in there once you inject them. When you inject, you feel like a little bit of pressure, like it feels like a little balloon filling up. Really doesn't hurt. My mom said she felt like maybe a little nerve pain because it was kind of pushing on a nerve. That's rare, but you know, just quick zip, zap, done, no big deal. And she's been good since. I took her to the airport this morning, actually, and she will start healing. It's not instant. Usually takes 3 to 6 months for peak results, but it will target inflammation. It'll start guiding the removal of scar tissue. It'll start regenerating tissue. And these type of stem cells, mesenchymal stem cells, they're like the manager on the construction site. You seek out the inflammation, tell everyone what to do, barking orders, create a healing environment. And the big thing is getting rid of that scar tissue, which white blood cells come in, do a patch-up job, and your normal healing factors can't get past it. So the stem cells get in there, they clean it up, they start repairing, and usually 3 to 6 months later, it just stops hurting, never hurts again. Now with cartilage, if it's first or second degree, it's almost always one and done. Third or fourth degree might take more than one treatment. So the sooner you can come to us, the better. Meniscus, ligaments, tendons, those tend to be one and done, though it does depend how bad they are. So we really do hope we can, you know, we're using enough cells that 50 million is a lot of mesenchymal stem cells, that it's just one done. We never have to see you for that again. You probably come back for something else. Everybody tends to hurt something else at some point, but you know, we really do want this to be a fix. We're not, you know, like in the US, some, you know, pharma company, oh, take another pill, here's another pill, you know, keep making money off you. No, we want to fix you. We want you to feel good because we know you're going to tell other people and you'll probably be back for something else. So our goal is to help you as best we can at the best price possible. And it's real easy. So most people fly down, we do some blood work and MRI the second day, third day, review it with the doctors, make sure it's a good fit. And if we think we can help, great. If not, we'll tell you because we know bad news travels faster than good. So we're always very straight with people. And then day 4, we do treatment, boom, quick, easy injection. Day 5, fly home. Couldn't be easier. If you'd like to learn more, get a hold of us. It's www.dreambody.clinic. You can call us toll free at 888-704-3977. I'm Josh, happy to help.